Some women will have both their breasts removed to make sure they do not get breast cancer. But KCAL 9 has learned of a less drastic measure that can reduce your risk by 50%.
Also a warning for...
The idea is simple. Reducing breast size will also reduce your risk of breast cancer. While most women want to keep what they have, others at risk for cancer may want to give this some thought. Women at risk for breast cancer often do whatever they can to reduce that risk, live a healthier life, get regular exams. But they never really know when or if they'll get bad news. From year to year, mammogram to mammogram. Now a new study from the Journal of Plastic and Reconstructive Surgery has found something truly remarkable.
It was a pretty big study, 32,000 women, and it found that women who have breast reduction have less of a chance of getting breast cancer. It was all populations, including women who were at high risk.
One of this country's top plastic surgeons, Dr. Brent Moelleken.
When you're doing a breast reduction, you're removing breast cells, including those that might develop into breast cancer cells.
So just how much has to be taken off to reduce the cancer risk? Well, a D-cup woman would have to be reduced to about a small C. A woman who's already a C would go down to a B-cup. And the reduced risk?
We're talking 50% reduction in breast cancer. It's enormous.
Enormous and potentially life-saving.
Over 200,000 women in America this year alone will get diagnosed with invasive breast cancer. 200,000. And 40,000 will die from it.
Dr. Moelleken says reducing breast size to reduce cancer risk is ideal for women who may need or already be considering a reduction. But some women who are terrified of getting cancer opt for a more radical choice, a double mastectomy.
We know already that people who have a prophylactic mastectomy lower their risk by 90%. But it's just such a high price to pay.
Now, another alternative.
They can have a breast reduction and reduce their chance of breast cancer.
Well, for more information on this and on Dr. Moelleken, you can go to our website at kcal9.com and just follow the links. Now, Dr. Moelleken says more studies with similar results are needed before women at risk receive an actual recommendation for this procedure. Really amazing study that he's brought to us. But for women who are truly, truly worried, they may very well consider this. So it's fascinating. And it's not as radical as some of the other approaches out there for women.
Yeah.
Thanks, Dylan.
Sure.